So we're here to talk to you today about psychedelic-assisted therapies. And we've been at Liminal Medicine together for about 2.5 years. Yeah. So Liminal Medicine is the three of us and 2 other therapists, and we've all been working together for 2.5 years now. We're going to talk about ketamine-assisted therapy because it is the one federally legal psychedelic that's available right now. And then we'll also talk about legal psychedelic work and research, which at this point covers almost every psychedelic is being researched. So we can pretty much talk about anything. And we'd also like to acknowledge our debt and gratitude to the indigenous peoples and cultures who've used psychedelic medicines for eons and have brought this information forward to us to use at this point in time. And also we acknowledge our debt and gratitude to the work of the underground therapists who've also been doing this work since the 60s and at great personal risk, and have also been able to bring this work forward and to help all of us work with these medicines. All right.
So I'm a somatic psychotherapist, and what that means is that I also work with the body. The body holds trauma. And so just talk therapy doesn't work so great when people are trying to move with trauma. And so I'm absolutely interested in what the body and how the body holds that trauma. And I used to be a case manager at Sonoma County Behavioral Health. I used to assess people at psychiatric emergency services. So I've seen a lot of people have big crises. It doesn't scare me. And I've been working with ketamine-assisted therapy for about 5 years. And I love my work, and I've really seen people make some really big breakthroughs. You still have to do the work, but I think these medicines are really amazing. So how did I get into psychedelics, you say? Well, there was college and the Grateful Dead, but then, more recently in the last 10, 15 years, I had a bunch of family members die at once. It just seemed like it just kept happening, and talk therapy wasn't really helping me. And so I actually had some friends who were doing psychedelic therapy, and I got involved that way. I started learning about different medicines, plant medicines, and then got into ketamine. And I got a ketamine therapist. And ketamine is one of the most profound psychedelics out there. And I've tried many. It's really amazing psychedelic. And what's wonderful about it is that it's somewhat short acting, and you can kind of get on with your day, whereas the other plant medicines can really take a big chunk of your time.
6 to 12 hours.
Right.
Yeah.
So it's a little more convenient, although I don't want to make it too quick. I mean, it takes time. It's really helped me quite a bit with depression and anxiety, and I started studying it more at Polaris, which is one of the big ketamine assisted psychotherapy clinics or institutes. Mm-hmm. One of the first in San Francisco.
And also one of the great
best.
Training. Yeah, one of the best, and a really great training center as well. I did my training there also.
Yeah, just wonderful scholars that are into psychedelics and really want to help people. So great program.
And I'm Suji Tvarmatis. I'm a physician. I'm board certified in family medicine. I did the California Institute of Integral Studies certification in psychedelic assisted therapies and research, and finished that in 2018. That's a 9-month program. And then I also went to Polaris Insight Center and did their training in ketamine assisted psychotherapy and also the medical parts of that. I've been here since I've been working at 2021 at Liminal. So now I'm the medical director. And how I got here is I worked with mostly underserved populations. I worked with Indian Health. I worked at the homeless clinic in Santa Rosa. All these populations have a lot of trauma and a lot of depression and a lot of issues that really aren't being treated well with our current psychiatric medications. And I was hearing about the research in psychedelic treatments and got really excited by this, about how this is a new breakthrough treatment modality for a lot of people who are having a lot of issues with psychiatric issues. Next. So here's what our friends think we do. Which, let's just think the baseline's going. And this is what we actually do. So, the new hope of psychedelic medicine. I'm sure you've all seen this, the psychedelic renaissance. Like you can't go a day these days without seeing an article that some new research project has come out. There's, all the stuff sounds really great. But what actually is psychedelic medicine and what can it treat? So the important thing to know about the use of psychedelics for treating any of these conditions is it's not just the medicine, it's the medicine and the therapy together. All this research shows is working with the medicine and the therapy at the same time. And that's the most important thing. Part of the issue of getting this through the FDA is trying to get that concept through to them. I know that MAPS it's a nonprofit that's been working on getting MDMA through the FDA for 30 years now. And the FDA is set up for you just you get a pill, you take it every day, and you just don't talk to us anymore, and that's it. Sometimes you just take it forever. But this is not that type of a medication. So it's been a very hard issue getting it through the FDA because it's a novel approach. So conditions being treated with depression, suicidal ideation, PTSD. So how does it help? So there's a lot of theories on how psychedelic medications, including ketamine, are useful in helping these different issues. And the two most important things to know, all psychedelics will do both neurogenesis and neuroplasticity. And so neurogenesis is psychedelics actually have your brain begin to make new brain cells and to make new endings on those brain cells. You actually grow these new neurons. And neuroplasticity means the ability of different parts of the brain to hook up and form these new pathways. And this is a really great picture of neuroplasticity. This is from a psilocybin research project where they took all these people and put them into functional MRIs, fMRIs. They did both people who had the placebo and people who got the psilocybin. And these are the different areas of the brain are on the outside edge here, just to make this graphic, be able to show the connections. And this is like the amount of connections people had after the placebo. These are just all these different connections between different areas in the brain. And this is the kind of connection you get after a psychedelic. This is psilocybin. And as many people will point out, it's this is your brain and this is your brain on drugs.
How much psilocybin was that?
Ooh, good question.
Good question.
That research project, it's 20.
The right amount?
The right amount.
I don't know. I mean, it looks pretty good, doesn't it?
I think.
I don't know.
Next one. So I can't remember.
There's a picture like that for the ketamine.
No one's done it. Yeah, it would be great, but you need to have the fMRI, which is a huge machine and all the time on it. The snow globe effect. So this is really another analogy about how we think these medicines actually help the brain. And so if you think about your brain as like a very big snowy field and you're going down this one pathway in that field and you keep going down that same pathway, you've broken through the snow and you're getting this deeper and deeper path. And it's really hard, as you can see, to break another path into the snow. So maybe this pathway goes into like something negative like depression or OCD, or this is a PTSD pathway in the brain. One of the analogies of how this works is that the psychedelic takes your brain and sort of turns it into a snow globe, shakes the whole thing up, and lets it all settle so that it's all a new snowy field with no pathways in it. I mean, there's pathways, but it gives you an opportunity to have a clean slate to start making pathways that might be into better, more positive places. And that is another reason why you really need the therapist with you to do this. So we work with ketamine. Why ketamine? It is the only legal psychedelic. None of the other psychedelics are legal at the federal level, so it can only be used within certain states under certain particular prescribed areas. But this is the only psychedelic that we can use at the federal level. My license, my DEA license as a physician, is held by the federal government. So even if the state I'm in says that the psychedelics are okay, I can still lose my license to prescribe because it's not okay at the federal level. It's the same thing with cannabis as well. And ketamine really works like a psychedelic. And it works even if you're taking antidepressants, which is really important because we see so many people on antidepressants. They're really hard to get off of, and you don't have to be destabilized. You can continue to take antidepressants as well as mood stabilizers for the most part. And it has a very rapid antidepressant effect.
Yeah, these are the types of things we've been able to treat successfully with ketamine. I've definitely, for myself seen, I had a client who was very addicted to meth, and within about 4 treatments, it's like he broke up with meth, and he did it during the journey. Like he was like, dude, I gotta let you go. Yeah, you're wrecking my life. Yep, you gotta go. And it was so funny. Like 2 days later, he's like, yeah, I'm really done. I don't need it anymore. And it really changed his life. Suicidal thoughts. That's almost like within a day, of treatment. Yeah. The first treatment. It rapidly helps people with suicidal thoughts. So it's a very powerful medicine and very helpful. And I think the main thing that it can help people with is help them figure out, like, why? Why am I doing this? What's happening here? And that often comes up in the journeys. That's the medicine that working through you, showing you places in your life where you might have created this OCD thought and how to break it apart. Next slide.
These are the contraindications.
Psychosis or schizophrenia, really not even like cannabis or alcohol is great for psychosis or schizophrenia, right? So don't do ketamine if you've got this going on. Any active mania, we do treat people with bipolar, but if they're actively manic, that's not a great idea. And some personality disorders. So people who are very, very stuck in a story of being sick and really blame a lot of people don't typically do well with psychedelics.
Have you done it yourself?
Yes.
Okay. And what was your experience?
Well, let me just say that at our clinic, we require that people have the actual experiential training with the ketamine, because there are a lot of places where the physicians and the other providers have not had the experiential training. And I think you don't really understand what you're working with if you don't know what's happening within that medicine.
So I would just say for myself, like being able to take that medicine and kind of see some bits of my childhood kind of re-explained to me, or seeing it in a different light really helped me kind of free me from some of the grief and the pain that I had from pretty difficult. That was kind of, briefly.
I would like to hear,
And it's what a relief, to be completely out of your body and away from your story.
Yeah.
I like that.
Yeah, that's really helpful.
So we're going to talk about the medical contraindications for ketamine, which is heart disease. If it's not stable, like if you have well-treated, controlled hypertension, you're fine. If you've had a heart attack, but your cardiologist says you're okay for anesthesia, you're fine. Uncontrolled high blood pressure, people who have aneurysms because your blood pressure will go up. People with liver disease because this gets broken down by the liver, and people who are pregnant, definitely contraindicated. People with increased intracranial pressure, and people who are oxygen dependent. Incidentally, some of the other psychedelics, especially psilocybin, if you have a particular heart problem or heart conductive issue called long QT syndrome, it can be psilocybin can actually be very dangerous for people with long QT syndrome. So it's one of those things to just think about. And even the natural medications can have some of these repercussions. So the side effects, pretty small in side effects. It will actually increase your blood pressure 10 to 20 points. So we always check people's blood pressure before and after, make sure that you're in the right range. If you're not in the right range, we have medications to bring that down in the office. And it can cause nausea and vomiting, mostly in people who have motion sickness, or who are easily nauseated. And so being a medical office, we can also treat with, Zofran or with other medications to prevent the nausea or to treat it afterwards. And then there's a theoretical risk. We know that people who use ketamine, as a street drug can get this bladder pain issue. It's called cystitis. There's never been recorded incidents of this happening within clinical settings, so we don't know. So it's a very theoretical risk. We tell people about it, we ask them about it, but it has not been seen in clinical settings, but we do know it happens on the street. We don't know, is that because people are using really large amounts every day? Is it what the medication's being cut with? We just don't really know, but it's a theoretical risk. So ketamine for depression especially is a great treatment. It's not a cure. Some people, or I'd say a certain percentage of people, are going to need boosters, and that's just one injection every 3 to 6 months or 9 months or longer at this point for some people.
And that's just to keep them stable?
It's just to keep, your mood up in the right place, yeah.
Ketamine really helps people with suicidal thoughts. And I'm not quite sure, they're not quite sure why, but that's very well documented. people who are in a very, very dark place, like can't even make eye contact, walking so slowly, they're so depressed, they pop right out. Typically that's more of an intensive treatment plan where they're coming in 2 or 3 times a week for a couple weeks to really boost them up, but it is very, very, very effective.
Yeah. We also see adolescents and teens for this as well.
Teens.
As a family therapist, as a family physician, I can see kids because I'm trained in working with children. So we see our youngest patient so far is 13. They have to be at an age that they can understand what they're consenting to or what they're assenting to. And of course with consent of their parents. Most of the kids we get are so suicidal they can't be left alone, and they are in psychiatric hospitalization, and this is a last-ditch attempt to get them out of this suicidality. And so far, knock on wood, none of the kids that we have seen has committed suicide. They're all still alive. Most of them were able to leave the hospital after the 4th treatment.
What I do notice with teens, though, is boy, they get better faster.
Yeah, they do.
They really do. It's so great because they're not so attached to their identity. They're just like, I don't know who I am. So they'll let stuff go and really grow so fast. I really love working with teens.
So ketamine in particular has a lot of different ways you can use it. You have lozenges, or also known as troches. That's these up here. You have to keep these in your mouth for 15 minutes and build up the saliva. It's a very bitter taste. And then you can spit it out or swallow it. It comes on a lot slower than the other methods, but it is a pretty easily accessible option. Nasal sprays, there is the Spravato, yeah. You can actually get compounded nasal sprays, also Spravato, which is a commercial version. Spravato is the pharmaceutical companies do this a lot. They'll take, there's usually a right and left-handed molecule for a drug, and they will take one out of it, and they will patent that so they can make a brand name. And so that they
charge you lots of money for it.
Yeah. It's about, I don't know, it's probably about $10 worth of ketamine in the nasal spray, probably less than that actually. And now they're charging $500 for it. Yeah. But on the other hand, insurance is covering it. So for some insurance is covering it. So that is a big, nasal sprays, the one drawback to that is you can't get extremely high doses in that way. You can get enough in to relieve depression, and you will also get the ketamine dripping down the back of your throat for a while in a very bitter taste. And then IV, which, we all know what IVs are. There's a lot of IV centers doing this. You go in, you get hooked up to the IV, you get pretty much the same amount of ketamine we do as injection, but over about an hour or 45 minutes. So it's a lot slower. A lot of IV places are run by anesthesiologists who've never taken ketamine. So they see the psychedelic effect as a side effect that's to be prevented. In some places, was just reading that they're using Haldol, low-dose Haldol, along with the ketamine to prevent the psychedelic experience. But it still works, it'll still work as an antidepressant that way. I just think you're missing a lot of it, when you do it that way.
Yeah, what's the fun in that?
What's the point, right? Right.
Kind of, right?
And if you look at a lot of the study and the research in psychedelics, they're actually showing that what they call the mystical experience, which is what, everybody calls the psychedelic experience, that they say the mystical experience, if you have that when you're taking the psychedelic, it really correlates with much better outcomes than if you don't have the psychedelic experience, if you're on a lower dose of a psychedelic. Doesn't matter what the psychedelic is. And so this whole concept that you'll see going on now, it's like they're trying to make an LSD that doesn't make you have the psychedelic experience as an antidepressant. Or preventing people doing lower doses to prevent the psychedelic effect, I think is really misguided and really unfortunate. Yeah, it's just really a sad thing. But I think you'll see that eventually people realize that you do need that mystical experience. So to study mystical experience and research, you have to make numbers on things, right, to make it research. So they now have a whole mystical experience questionnaire so that they can grade what kind of mystical experience you've had in your psychedelic treatment for research purposes, which I just think is hilarious. So there's a lot of different ideas of how to use ketamine, and it's really kind of like the Wild West of ketamine right now. There's no, like, nothing sort of coalesced over what is the best way to do it, who should be doing it, how it should be done. So there's a lot of options for consumers at this time, and a lot of reasons for consumers to really want to do investigation and look into who's around them, who can provide the ketamine, and what the options are.
Okay, what do I want to say here?
Well, we think we do it the best, of course, but
yeah. I mean, I think that there's definitely a difference. Like, you can get, I'm sure you probably know, you can get ketamine at home, right? You can have a Zoom appointment with a doctor for 10 minutes, and then they'll ship it to you, and then they'll get someone who from, I don't know, some place where you can have a Zoom appointment afterwards. And if you're on a very low budget, I think you can get some help there for sure. The kind of container that we provide is really all about really deeply listening to you and following you and tracking you, tailoring that experience to what your needs are. And I just think you're going to have a better outcome than people just kind of getting medicine in the mail and talking to someone through a screen at the distance. I mean, I do know people who've gotten some relief from that, certainly, but I think having a therapist one-on-one with you is just a better experience.
Oh, all of our providers, by the way, are all licensed. We only work with licensed therapists. So we have LCSWs, we have MFTs. I'm a licensed physician, so we only work with licensed therapists because, I think guides do a really great job, and there's like a long history of the underground guides. But this also allows us to work with people with much higher acuity of mental health issues because we do have people who have really deep training. Okay, so ketamine-assisted psychotherapy, what is it? It is a very high-intensity and short-term treatment. So it's an adjunct to ongoing therapy. And the ketamine-assisted psychotherapy is combining psychotherapy with the administration of ketamine, obviously.
So this is where you could go. It's an idea. Especially with ketamine, people tend to really go into outer space. And they have those kinds of visions. Like, oh, my client today was like, I'm an alien, but I'm a good one. And it was like, he had a wonderful time out there.
Have you had that experience?
Definitely go into outer space, or the beginning of the universe.
Oh, yeah.
Yeah.
Have you?
Oh, yeah. You can have so many different, this is one of the strongest psychedelics in the world.
Yeah.
This is actually Anne pretending to be a patient. This is one of our treatment rooms, and this is one of our other therapists, just to sort of give the idea of you're in a recliner, everybody gets cold in the ketamine space, so you will definitely give you a blanket. And as opposed to a lot of other psychedelics, it's a very internal one, right? So you really need to have the blindfold on. You do really leave your body a lot, and then it takes a while to come back into your body and to get everything hooked up again, sort of. So having the blindfold on is really important, especially because your eyes don't register for a while once you get back. And so if you're looking around, your eyes will tell you that your things are moving, and your inner ear tells you, no, you're not moving. And those two things will cross over and cause a lot of nausea because of the way things are.
How long does that generally take to come back in?
Good question. Yeah, I would say, some people have really high metabolisms and they can come in and out in half an hour. And some people, typically, if they're coming up, we book 2.5 hours, basically. So we will give you boosters and keep you in longer if we feel you're popping out too fast.
Yeah. My job at the office is to get people the right amount high. Right? That is really my job. It's like, if you get too deep in there, you kind of hit this whiteout stage. You're not going to remember anything. You're not going to be able to bring it back. So you need to be deep enough in that you're able to be having that psychedelic experience, and you'll be able to get that information that's going on and be able to remember it and bring it back to work on it.
When you're working with someone, how do you measure how deep they're in and?
Oh, yeah.
Yeah. If they can respond. Yeah. And people will know. They'll go, yep, I'm coming back. And if I'm looking at the clock and we've got an hour and a half left, it's like, well, would you like a boost? Yes.
Yeah.
So that's how we kind of gauge. But sometimes people go way out and they can't hear anything really. They're just kind of in their own reverie.
Yeah.
And then they start to they'll move. And you're like, oh, you see they're coming back.
Yeah.
Do they experience bliss?
A lot of people do.
Yeah.
Yeah. A lot of people will experience intense bliss. Not everybody. And not all the time. The interesting thing with ketamine is it can be so different every time, which I think it's a lot different from the other psychedelics in that you get the same sort of experience every time with other psychedelics, but this one is very different, can be very, very different every single time.
So if you have someone who had a childhood trauma, it really hasn't been fully healed, would you work with them the same way or a different way?
Kind of to what you were asking, it's like you are a dissociative, so you will probably, or you may see things that happen to you as a child from a distant place, so you're not lighting up all the pain and the fear. So from that place, you might get like a more intuitive sense of like, oh, that's why I do that to myself. Okay. You're processing it from a distance. That's what's happening. That's very helpful for people, especially if they haven't really worked through some of their childhood stuff yet.
Oh, yeah.
Integration. So what we do at Liminal is we kind of come up with treatment goals for you. Like, if this medicine working for you, how would you know it? And so for a lot of people, when they're depressed, they're saying, well, I would actually call my friends, or I would probably try and figure out how I could exercise more. I would stop giving myself such a hard time. So we kind of list those goals. And then when we work together, I'll kind of set intentions with the medicine and then kind of see, so where are you? How are you feeling about that situation with your dad? Or how are you doing in your life, in your regular life? Do you feel like you have more courage, like you can talk to people? So that's kind of what I'm doing is I write down almost everything you say, and then we refer to it to help remind you of the imagery, because you often will forget. And then use those as little codes for the rest of the week. Like, oh, remember, you were somersaulting in space. There were no problems for you. Can you capture that feeling again? Even if your boss says, I don't like this paper you wrote. Can you remember, like, oh yeah, there's a place where I can not have these problems, or I can not feel so badly about myself. And that's kind of what we're doing, is we're trying to help you create new habits. Reach out more if that's what you need. Work with the insights that you get from the medicine and activate them. The medicine isn't going to do the work, like people have to do the work, but the medicine will show you what work needs to be done. And then I guess my job is to help you do that work. Group cap. Okay, so here we are in the West, and we're doing psychedelics in rooms by ourselves. And psychedelics were traditionally used in groups. It was part of what the community used to heal. And so there are times when individual therapy is great, especially if you've got a heavy trauma history and you haven't worked it. You may want one-on-one help. But if you're not in that place and you're looking to have an experience where you can be supported by the group, make new friends, talk about issues. A lot of people are really suffering with isolation, and they feel unsafe in groups. A lot of group wounding happens. Like, imagine, like, your family might be your first group wounding, or school, being bullied in school. Having a group experience with CAP could really help, like, free you from that. Being in a supportive group where somebody has your back and you can be vulnerable and supported. It's very healing. And it's kind of like with meditation. If you've ever meditated with a group of people, the energy goes higher. And so that's very true for here. The energy goes much higher when you've got a bunch of people with the same intention journeying together.
Have you ever been in a group?
Yeah.
Yeah, we do a lot of groups, and it's really pretty amazing. It's also an exponentially different experience, right? It like bumps up the experience like a whole lot. And and you get really close to people really fast when you've been journeying together, and that connection is really, really great. We have one group that still has us set up times, and we just run groups for that one group that wants to meet. It's been almost a year now, I think, and they come in like every 3 months, and we'll do like just for them. They just all come back together because they got so connected. What?
Have you ever worked with couples?
Yeah,
absolutely.
Yeah. It's a great way to do couples therapy, actually. Yeah, you don't have to do the full-on psychedelic. You can do more of a psycholytic dose, which helps you feel a little less defended and open and talking to each other. Absolutely, it's really helpful. So, yep, that's where we are.
Yeah.
Sebastopol.
Yeah, that's us, liminal medicine. But yeah, and so, let's take some questions. Not yet. No one has actually come on with that issue yet. I think that, this is one of the things that's worrisome about the at-home ketamine companies that are out there, because they don't know the patients as well, right? And so we know the patients as well, very well. And also, we have to run what's called a cures report, which in the state of California, anybody who gets any type of controlled substance, it goes on this state report that all doctors are required to check before doing, using any controlled substances. So we can see if people are getting it other places or,
Yeah, I mean, this is more expensive.
And it's much more expensive, yeah.
So, I mean, maybe Elon Musk can do it, I guess. And he's been talking about ketamine lately. I don't know if you've heard that. But yeah, so yeah, that's not really going to happen here. And it actually does help people with addictions. I've definitely had clients say, gosh, I don't even want to drink wine anymore.
Yeah.
Like it just happens like that.
Yeah, I mean, we don't treat pain specifically, but chronic pain causes a lot of depression and does cause a lot of brain changes that cause that depression. So we do work with people who have chronic pain to help them work through that.
Certainly. I mean, the one client I'm thinking of, I mean, he, was a professional gymnast. He competed in the Olympics and he was amazing. And now 70 years old and unbelievable pain. He just lives on hydrocodone, And so even after his first treatment, he didn't need hydrocodone for like 2 or 3 days. It really because what it does is it resets the pain centers in the brain. So it's pretty powerful.
Well, it helps with some people with anorexia and bulimia. So it does help with some eating disorders. Yeah. And OCD. Yeah, those are kind of OCD behaviors. So it does help with those along with OCD. Yeah. Yeah. There are some, the eating disorders issue is something that's being researched with psilocybin, LSD, and I don't think anybody's actually, I'm wrong. Somebody is doing ketamine research with eating disorders. So that's a newer one. But they are finding a lot of really good results with psilocybin and LSD, treating that, using that in psychedelic assisted psychotherapy to treat eating disorders. The pain is a great question, right? Chronic pain issues. There is not a lot of research on it right now. And yeah, which is really unfortunate because I think it could be really useful, but there's just not a lot of research being done yet on that. It's really unfortunate. Doing therapy on psychedelics is a different experience.
Very different.
Because, you can get to all these things. One of the great things about doing ketamine-assisted psychotherapy is that ketamine, we do a 2-step method when we do it. We do a sub-Q, a small dose that goes under the skin. And that just we give about 10 minutes before we do an intramuscular injection. That gives the ketamine time to really get in and really decrease the activity in the fear and anxiety centers in the brain, so that then when you get that bigger dose, you into that ketamine space with a lot less fear and anxiety. But you also, when you're coming back in, you still those activity in those centers is still really low. So you're really able to get into a lot of very deep and intense issues and that's where we get a lot of the PTSD and like a lot of trauma issues coming up, because you can't approach them without that fear and anxiety happening. And you can actually get some of those memories out and just get them repacked without that trigger of fight or flight in there. And that can be incredibly useful for resolving PTSD.
And there too, like the psychedelic visions are what really helps support people's recovery. I had a client who'd horrible physical abuse, and like something had happened. She could see it from a distance, and then all of a sudden in her vision, all these angels came around her and just held her like this. She was just surrounded by angels, and she could feel all this energy moving up and down her back. And she was like, it was like the medicine had showed her there's support for you here, right? Like
hope.
Yeah, hope. Yeah, she kind of came out like, yeah, I don't feel scared. You know, I've got something. And I think that's what it is like, there's something, maybe that's all her psyche, right? I don't know. Were there really angels? I don't know. But like, it was a supportive vision that really helped her relate to her recovery in a very different way. And you're not going to get that through talk therapy so much.
Yeah, I think you next, but I think the other really interesting thing with using psychedelics, and especially ketamine, is that you can, like, one of the things is you get so pulled out of your body, and you get so far out there, and you get this really intense perspective on who you are and what your place is in the universe, sort of. And people will come back and they'll be like, I don't know, I was worrying about all this stuff. It really doesn't mean anything.
Right.
I don't know why I was angry about all these things. It doesn't mean anything. Like, what's more important is, like, you know, these things are what's more important. My family and, like, you know, being, you know, with people and that is just
people make
amazing.
Big changes because they die. You know, you kind of have this experience like, oh, I'm dying. Yeah. Okay. Oh, well. Mm-hmm. And then, like, when you come back, you're like, yeah, I don't feel like worrying about that anymore. Like, it's boring or something. It's like,
And we also work with people with end-of-life issues who have, like, diseases. And that's
beautiful.
So amazing that people get this feeling. It's like, oh, I understand that, like, what we are here isn't all of who we are, that we're, like, so much bigger than this. And people lose their fear of dying. And that is a really amazing, amazing thing that we can do for people. Yeah. Ketamine is a completely synthetic molecule, and I know that there are a lot of people who prefer not to work with synthetics. I do think specifically for me, working with ketamine means that I'm not stepping on anybody else's tradition. It was made in a lab by some white guy in 1960 something in I can't remember which pharmaceutical company produced it first. It's now a generic medication, but I think that, and there's no natural source of this medicine, as is MDMA. MDMA has no actual natural source. It's also a completely synthetic medication,
we honor that medicine, though. You know what I mean? I feel like ketamine is a very heart-opening medicine, very kind. And we
Super
kind of
kind.
set an intention and, like, honestly, we pray over it and ask for help before
bless it.
Before we give it to people. Because I agree with you. I think that, you know, the energy you bring to something is going to affect how it affects you.
Right. And I also believe, right, we as humans have this ability now to start figuring out how to alter our own brains. And this is one of our ways of doing that. And I think that is also a completely valid option. So and I think that I'm extremely grateful for this medicine, and I'm extremely, extremely honored and thankful to be able to work with it. One of the things I don't think we talked about much is that that I think is really important is you can use this medicine and get incredibly deep psychedelic experiences, even if you are taking all the, you know, mood stabilizers or antidepressants and all these other things, where all the other psychedelics are working mostly within the serotonin system and they are signaling system, and they will not, you will not respond as well to them if you're taking those. So I'm just so grateful that we can actually help people who are in the middle of these other medicines, right?
Ketamine's been around for
it's been
a
around
long
since
time.
63, I think, 62. And it is, you know, it's considered extremely safe medication. It's the most used medication for anesthesia for children in the United States. It's the most used anesthetic medication in the entire world. It's extremely safe as an anesthetic because people protect their airways. We use it at much lower level, right? But it is a very, very safe medicine. But yeah, I mean, you know, every medicine, no matter where it comes from or what it is, has, including water, right? You can overdose on water as well, but every medicine has some danger to it, or some, I don't want to call it danger, but some issue that, you know, how you're using it, right? Because you can also die from drinking too much water. So you just be aware of these, as with any other medicine that you're using, right? Any psychedelic you're using, you just want to be aware of what's going on. Anyway, thank you everybody for being here. I totally appreciate it.
Nice to meet you all.
Yeah.